Top Med Talk.
Hello and welcome to Top Med Talk Down Under. I'm Kate Leslie and I'm here with my co-host Andy Cumpstey at the Australian and New Zealand College of Anaesthetists and Faculty of Pain Medicine annual scientific meeting. It's in Cairns in beautiful far north Queensland in Australia. We're getting to the end of our first day and it's been full of great plenary lectures and breakout sessions and workshops. What have been the highlights for you, Andy?
Well, we've had two brilliant plenary sessions, Kate, with, three excellent talks in each one of those sessions. And I don't want to steal the thunder of our speakers we're about to speak with in a second, so I'm going to focus on some of the British talks that have followed me out from the UK, and both Professor Ramani Munasinghe and Professor Kevin Fong gave fantastic plenary talks, very different, but really, really inspiring and thought-provoking, both about the state of the health service in the UK and the NHS and things we can do about that, but also about risky business, as Kevin talked about. And he was very eloquent, and we often downplay ourselves as anaesthetists, but we do a really complex thing with some really sick people, and we have to manage that really, really well. So I'm really looking forward to speaking to both of those later on in the conference when we have them on the podcast.
Yeah, that'll be fantastic. I really liked there's a thread, or a sightline through the conference now about sustainability.
Absolutely.
Right from the theme, which is future-proof, through the welcome to country, which really emphasised the role of the Indigenous people in caring for the land and the waters around Cairns. And then two fantastic lectures from our guest, Eugenie Kayak. And they've just come from a terrific session about sustainability as well. So that leads us on to welcoming our two guests. Eugenie, would you like to tell us a bit about yourself?
Oh, well, thank you. And thank you for having me. So I'm an anaesthetist in Melbourne, work at the Alfred and Austin and in private. I also have a position at the Melbourne Medical School where I'm the enterprise professor in sustainable healthcare. And for the last 15, 16 years, I've been working closely with Doctors for the Environment Australia and other medical organisations in Australia to raise awareness about climate change and health, and also healthcare's environmental impact, and to actually work to address both of those issues.
Fantastic. And we're lucky to have Dan Lazzari. Dan, can you tell us a bit about yourself?
Sure, thank you, and thank you for having me. So my name is Dan Lazzari. I'm an anaesthetist working here in Cairns in the public. Been here since 2018 now, feels like a little while. And from my sustainability point of view, so we essentially established the sustainability initiatives in Cairns Hospital that were really non-existent a few years ago, initially by setting up what we call CTEC, the Cairns Theatres Environmental Committee, which is a multidisciplinary group of people in the perioperative environment that look at how we can sort of address the issues around sustainability. And also involved in the hospital steering committee that looks at, again, the greater approach to how we can assess and improve our sustainability and what we do in that space, which has been really exciting because we sort of came from nothing and feel we're still very much on the steep upwards curve in what we do.
Fantastic. So we'll get back to your local initiatives in a minute, but I was really struck by that fantastic photograph you showed, Eugenie, of you, David Storey and Forbes McGain as enthusiastic young climate warriors. And you were at the ANSCA meeting that was held in Cairns in 2009.
Yes, that's right.
Yeah. Can you tell us about your journey since that fantastic photo with the Doctors for the Environment? I think that's what you call it. What's the acronym again?
A DEA, yes, so Doctors for the Environment Australia, and that was one of the first initiatives that I really sort of took charge at, and decided that I would set up a booth here in the Cairns ASM back in 2009. So that was great, and I was very fortunate to have David Storey and Forbes assist me with that. Soon after that, my journey with DEA went from being a general member to being on their board. Then I became the Victorian chair of the organisation, and then a few years later the deputy chair nationally. I was co-chair as well for some time. And after taking the organisation through a governance review and constitutional change to really bring it along from being a management committee run organisation, really like most NGOs, I guess it started as a kitchen table organisation, around the kitchen table, to something that was more professional and had the capacity to grow and be the organisation that it needs to be today. So I'm no longer on the board. I think 11 years on a board of an organisation is enough, but I'm still very fortunate to be convener of their sustainable healthcare work.
And what do you consider the major achievements of the DEA to have been?
Well, there's quite a lot of major achievements. I think as a relatively nimble and independent organisation, they have the capacity to really sort of be at the forefront about raising awareness when it comes to issues that may potentially governments, our health organisations may be a bit hesitant at doing, even our medical colleges. So as I talked about today, it really was the organisation that raised awareness around climate change and health in Australia, and we're talking 20 years ago then, how coal and fossil fuels are a health hazard, and that's back 15 years ago when very little was being talked and actually campaigned around that. I think it was a privilege to be able to lead a challenge in basically a court of law, the Victorian Civil and Tribunal Commission, to stop a new coal-fired power plant. It's been educating medical students and professionals for the last 2 decades around climate change and health, and also sustainable healthcare and about getting our own house in order.
I think that anecdote you told about your advocating to the government and in VCAT about the coal mine showed that doctors can actually make a difference, that we sometimes feel impotent about doing anything except pointing out what's wrong, and we can actually move forward and make change. It was very
Absolutely.
impressive.
I think we have to get over that, and sometimes we have to get over the fact that we feel that it's not our place. Climate change is very much a health emergency, and as I said, if it's not us who's actually raising the alarm and leading action, then who do we expect to do it? Read recently that it's actually too important for us to rely on the whims or the changes in our democratically elected governments. I mean, obviously they should be acting, but we also need to be really ensuring that the appropriate action is occurring, and it's occurring now. So we have a very powerful voice, and studies have shown over and over again, surveys, that health professionals, nurses and doctors always come out on top when they're asked about the public are asked about who they would trust, who do they believe in providing information to them. We need to use our voice.
And what do you think the next thing that doctors should address should be? Or there are things left over from our agenda in the last 25 years that we've clearly haven't achieved yet?
Well, yes, that's an interesting question, because I'm not sure that there is the next thing. Climate change and health is still there. We haven't actually solved or moved far enough to address the issues such as the burning of fossil fuels to mitigate the health impacts of our increasing, rapidly changing climate. Our health industry, our health sector. There is such an opportunity, I think, there if we actually take a really hard look at how we practice healthcare, looking at it being more sustainable, environmentally sustainable, financially sustainable, and better patient care outcomes. So looking at the triple bottom line of healthcare. And I like to think that it's a real opportunity to transform healthcare. And again, if it's not us, then who's going to do that? At the moment, our healthcare system is unsustainable. It can't keep going in the trajectory that it is, both financially and environmental impact.
I love that. You say that often. If not us, who? You know, it's a great, inspiring and pithy thing. Don't you think, Andy?
Absolutely. And I think I'm going to come to you now, Dan. I think from been touring around Cairns the last week or so, I think you're in a very fortunate or unfortunate position to really see firsthand, if it's not us, what the impact that has on our local environment here at the reef and the rainforest. But before we get into asking you what you and your department have done specifically, maybe we just take a step back, and for our listeners who've never been to Cairns before, never been to Australia, how big a department is your department? How big a hospital is it here? maybe just put into context the team that have been doing this work, and then we'll look at what the work they've done in a second.
And how far it is from everywhere else.
Sure, yeah, thank you. Yeah, so we're sort of like, it's a large regional hospital. I'd have to check, I think 1,200 beds or so. We run 12 operating theatres. We're about 24 full-time staff as a senior anaesthetist. But I just did want to say about the DEA, we certainly took a lot of inspiration when we sort of took our first baby steps in organizations that were leading the way, such as the DEA. And I think that's part of the importance of taking the first step and showing leadership and empowering people to be able to say, actually, I want to do something, and I feel like I now have backup. I'm not the only one standing up there, sort of shouting from the rooftops, as it were.
Yeah, and I think, so we were chatting before starting the recording, and obviously you've been very fortunate and travelled to lots of different places, but I guess to put that into context with some UK listeners, I mean, some of our small, what we would call district general hospitals are not much bigger than that. And your team's made a real difference and impact, hasn't it, locally in terms of sustainability? Do you want us to talk through some of the things you've done?
Sure. Yeah, I feel like we were fortunate to, because we do have the fact that we are near the rainforest and the reef and an amazing amount of natural beauty, and important that is, at the forefront of the effects of climate change as we see daily. And so I don't think that's necessarily the reason why we had such buy-in, but as soon as we started sort of talking about looking at how we practice and what we do on the ground in the hospital, we had an incredible amount of support across all specialties and divisions. People that wanted to do things but just didn't know how to proceed. And so a lot of willpower, a lot of sort of strength to come forward and act, essentially. So we did sort of inadvertently become sort of the central focus of sustainability within the health service.
And over what sort of region did that focus stretch out to? I'm reliably told is at the top end of Australia. Kate's given me the lingo to learn. So when we talk about the top end, for people that, like me, are not Australian,
sure,
what does that mean?
So Cairns is the major hospital in our district, or HHS health service. There are probably another 3 or 4 small to medium-sized hospitals within the area. And certainly at this already, because of our geographical isolation from the greater metropolitan areas, accessing services such as waste and other sort of process becomes expensive and more complicated. And certainly that's the case for even the smaller facilities, who even on the tablelands, so area within an hour from us, they do not provide domestic recycling because it's just not viable at this point from their point of view. So it's quite surprising. So there's certainly a lot more that can be done. Yeah. Which is a challenge, but also an opportunity to make change within the systems.
And again, for people listening at home, so I was fortunate to visit the Tablelands a couple of days ago, but it's only an hour's drive out of Cairns, but it feels like a totally different environment. Just different flora, different trees, different temperatures, different humidity levels. So remarkably close to Cairns, the city, but actually a very different environment.
That's right.
So it's interesting that affects the sustainability options as well.
Yeah, correct. And it's one of those things, and that's where I think certainly at the smaller level, taking a multidisciplinary approach to how you look at things and getting input from all the different support services that can highlight what you can, what you can't do, and why. Because you might have a great idea, but if it might not be implementable because of sort of organizational reasons and so on and so forth.
So have you got any specific examples of things that you have done across that network that have been very effective?
We sort of did partner with a private company who was taking our plastic waste and transporting it. So they're focusing on healthcare plastics and transporting it back to Brisbane to get reprocessed into new items, which was great. And probably that sort of partnership ceased because the project arm of the company ceased. But probably the most interesting thing that came out of that was their research into our healthcare plastics. Right. Being a plastic manufacturer, they knew quite a bit about plastics. And when they looked at what we would be sending to the recycling, it turns out a lot of our plastics are actually mixed types. Right. So they're not straight LDP or whatever it may be. So if you send a milk bottle to get recycled, they make more milk bottles because it's the same plastic. So that highlighted the fact that we were previously sending our plastic recycling to the local recycling facility, which best case scenario was going to landfill because the machines wouldn't recognize it as the correct type of plastic, or worst case would actually be contaminating the relevant waste streams. So although that project fell over, it actually highlighted the fact that we really shouldn't be sending our plastic anywhere apart from to landfill because it's not actually doing any good. So it's probably highlighted the fact that you think you might be doing good, but you're actually potentially doing harm.
Yes.
But we wouldn't have known that unless they'd actually looked at what was in our plastics.
So, Eugenie, maybe following on from that point, with DEA, I mean, that's a now, huge reach across the whole of Australia, isn't it? But I mean, are there resources, are there opportunities through organisations like that that can help people reach out and start these initiatives and give them a bit more guidance initially? Or
Well, I might even go back a step actually, because it just, I think, also really emphasises that recycling is good and it's important, but when it comes to addressing healthcare's environmental footprint, we can go back and look at the waste hierarchy,
yes,
can't we? So actually look at first about minimising use of unnecessary equipment, and that includes plastics and packaging. I mean, packaging is actually something that really I think is ripe for opportunity to address. So using less, reusing, so moving to reusable equipment, ensuring that our waste segregation is actually correct as well, because I don't think there are actually, unfortunately, many hospitals that do waste segregation well. And by that, I don't even mean necessarily recycling, just general waste and clinical waste. And yes, reprocessing. There's not very much of an industry in Australia around reprocessing, more so in New Zealand and in America. It's $1 million, if not $1 billion industry is reprocessing medical equipment. And then, yes, recycling. Though not to disregard recycling, because again and again, I think it's really the hook that gets staff engaged. So it is one of the things that they can do and it's tangible and they want to do. So it is important. But there are also other aspects when it comes to dealing with our waste streams to also really consider.
I think the waste it's such a huge issue. And I mean, speaking personally from our work in Southampton in the middle of the south coast of the UK, I get emails currently, multiple times a day, if not at least once a day, about our waste segregation because we're being fined for putting things in the wrong bin. And now in our intensive care units, where there used to be 2 or 3 bins for recycling, we now have 7 or 8 bins, and they're all colour-coded. And it's actually really difficult for healthcare staff to put things into the right bin. And you talked about minimising waste, but often we open a central line pack and there's tons of things in there that never get used, but then all this gets scrunched up into one pile in a rush and put in a bin, and that's where we're failing the waste audits.
And in my mind, that they're the easier wins, actually. Why aren't we looking at what's going? And some people are. What's going into our surgical packs, our central line packs? Is it really only the necessary minimum, and then we ask for extra if we need it? There's so much rethinking in our clinical care, our operations, that will benefit the environment and also our bottom line.
Absolutely. And as you highlighted, the recycling is really the bottom, like the last rung of what we should be doing, and is that challenge. And as you're saying, with that's what you can see. So you can see the waste, but once you've made the plastic, a lot of the damage has been done.
Yes.
The emissions from that item have been created and emitted. Sending it to landfill is not great, but we should go back and not use it, not make it in the first place. That's really where we need to be targeting. Whereas a lot of the focus, especially when you speak to staff, is, as long as we don't get it going in the ocean, a turtle doesn't swallow it, it's not a problem. But it's going back to, if you don't need it, don't use it. And if you can establish that, and if you can strengthen that, then all the flow-on is dealt with.
It's a really good point that you make, Dan. And I remember talking to you about this before, Eugenie, about increasing the amount of medical equipment and drugs that are made in Australia to reduce the distance that they need to travel to get to our patients. Do you know if there's any improvement in those types of supply chains in Australia?
I don't actually know if there's improvement, but I think, unfortunately, because I think let's go back to COVID, actually. We realised then just how vulnerable so many of our supply chains were. And there were a lot of promises made then. And I think they are still particularly vulnerable. But where if we, one, make things in Australia, but also have reusable products. So if we're reusing things, then we're also decreasing the vulnerability within our supply chain. And that's got to be good for the environment and also for our patient care. So next time we have a big world event, and there will be, whether it's an extreme weather event or a pandemic or something, we have more more capacity within our supply chain to provide the healthcare that we need. And I really hope that there'll be more focus on that over the next few years.
I wondered if we could pivot to the health consequences of climate change. You mentioned that briefly in your talk this morning, but I wondered if you could recap that for our listeners.
Yes, of course. For well over a decade, 2 decades, there's been evidence, scientific papers written, The Lancet in 2009, really highlighting that climate change is potentially the biggest global health threat of this century. Why are they saying that? Because it impacts the fundamental determinants of health as described by the WHO. So access to clean air and water, adequate food, impacts disease, vector-borne diseases, even impacts adequate shelter and freedom from conflict. All these things impact our health. So climate change is an amplifier also of existing health conditions, and those with pre-existing disease or medical conditions, and also the most vulnerable are also unfortunately more susceptible to the health impacts of climate change. It might be, we always think about trauma and mortality from extreme weather events, but as I also said this morning, there's a new study that came out very recently that a meta-analysis that found that probably over 7% of the cardiovascular disease burden in Australia can actually be attributable to heat. Heat being the silent killer.
It's fascinating.
Yeah.
Kate, I just wanted to pivot back to when you were mentioning about transportation, because I think, I don't know when your experience, Eugenie, but the few life cycle analyses of items that we've looked at have actually shown that the transportation component of emissions is actually reasonably small for most items. A lot of it is from the manufacturer and the sourcing of the raw materials, which I think highlights, but again, that's what we see, we got to put it in a truck, so that's not good, which it's not. But if you are able to source a product that's superior to what you have available locally, maybe more reusable or more environmentally friendly, don't be afraid to transport it, because it's actually generally, obviously life cycle analyses are very complicated, expensive things to do, but currently the ones I've seen have shown that it's not a great component to the overall emissions, so it may be worthwhile getting it from further if it's the right thing for you.
So this is a question without notice, I apologise, but Eugenie mentioned vector-borne diseases. So in Cairns here, we're in the tropics, and we're closer to New Guinea and Southeast Asia than we are to Brisbane, which is 1,600 kilometres away, and to Melbourne, which is 3,000 kilometres away. In fact, I was reflecting, your closest referral hospital is 350 kilometres away, which is the distance between Plymouth and London.
It is, yeah.
And you drive past a few hospitals, including Southampton.
You do. Some very big hospitals in that distance, yes.
And anyway, getting back to vector-borne diseases, are you seeing an increase in dengue fever and perhaps even malaria or other tropical diseases in Cairns?
Not at this stage. We have had a rise in melioidosis, but that's a different pathogen. Not so much at this point in time, but certainly what the future holds is unknown.
I know that health services in Australia are planning for an increase in those diseases moving south through Queensland.
Yeah, no, absolutely. And also, you mentioned dengue fever, but Ross River virus, Barma virus, Japanese encephalitis. There have been studies and modelling to suggest that they're all potentially on the increase due to changes in our environment.
Likewise, a threat to the southern areas of the state is the southern movement of the saltwater crocodiles, who are enjoying the warmer weather and moving south to areas where they previously weren't endemic.
But Andy told me earlier this morning how to tell the difference. Andy?
So when I was in Kuranda a couple of days ago, one of the tour guides, who all his ancestry, his family have lived and grown up in Kuranda for many, many centuries. He said that obviously you have two types of crocodiles here. There's the freshwater crocodiles and the saltwater crocodiles. And he said apparently if you see the crocodile swimming away from you, it's a freshie. And if you see it swimming towards you, it's a salty, and you better get out of the water quick.
That's correct.
So I don't know. I've not seen any crocodiles swimming towards me, but I think if there was anything swimming towards me, I'd be getting out of the water pretty quick.
Well, there's no crocodiles down in the healthcare industry exhibitions, and we want to get down there soon. So we'd like to thank both of you so much for coming on our podcast.
Great. Thank you very much for your time.
Thank you very much for having us.
So you can find Top Med Talk Down Under on our app and on our website, and also on social media. We're on Facebook, X, Blue Sky and YouTube. And if you go there, please subscribe and give us a big thumbs up. Every thumbs up helps. Finally, we'd like to thank our sponsors, BD, GE and Solventum, without whom we could not bring Top Med Talk free and open access to the world. Looking forward to next time, Andy.
See you later.
Top Med Talk.
Thanks for downloading Top Med Talk. Don't forget to subscribe, check us out on YouTube, and of course on social media. We're on Instagram, Facebook and X. Also, it's important to remember that Top Med Talk is the broadcasting arm of EdPom, evidence-based perioperative medicine. We'd love you to find out more about that, and the way to do that is edpom.org. Check out our website and find out about some of the incredible conferences we're going to be arranging across the year. edpom.org.